Welcome to another episode of Q&A with Dr. Sibthorpe, me and my fellow Barbara. What are we talking about today, Barbara?
This episode is all about dermal fillers.
Okay.
The first question is, are dermal fillers safe and what are the risks?
Dermal fillers are safe in the right hands. The risks, if they're not, can be quite severe. So you can get necrosis and even very rare cases of blindness if you've got the wrong person injecting you. There are certain reactions, side effects, such as like an allergy, and sometimes you get bruises, but overall they are safe and they've been around a long time as well.
Well, how do you know if you're allergic?
Sometimes you don't because the allergy may present later, so you get delayed hypersensitivity reactions. So you don't necessarily know that you're not allergic. When I started more than 20 years ago, we actually were using, in those days before the traditional fillers came along, the dermal fillers that we now have, we were using collagen, which is derived from animal. And so we had to do patch testing. But we don't do that anymore, and it's very, very rare that you would get an allergy to a filler.
Okay, good advice. Can fillers migrate or cause lumps, and can they be dissolved or removed if you don't like the result?
Fillers can cause lumps and bumps, and they can migrate, and they can be dissolved if you don't like the result. The trick is not to use large amounts. We use them in small amounts in strategic areas. And from that point of view, you don't usually get any migration. Certainly, I've not had any as a result of that technique. Where things go wrong is where fillers are placed in large amounts, the wrong depth, the wrong type of filler, and that's when the problems arise.
Okay, good advice. Can fillers be used for lost volume in the temples? I get that question a lot, especially from older women.
Yeah, so I think that's something that I treat a lot of is where, and I see it a lot in the ladies where they have significant volume loss in this area as they get older. And yes, you can treat it. There are a variety of techniques for treating that. I tend to use the deep placement because I get a better result. But you have to really know what you're doing because that's one of the areas, if you inject, you can cause blindness. So you need a safe technique and you need to understand your anatomy for doing that particular procedure.
Okay.
Yeah.
Can filler correct tear troughs and darkness in my eye area?
Tear trough fillers really do require some very good assessment by an experienced practitioner because they won't necessarily get rid of dark circles. They are good for depressions and loss of volume, but equally it's another danger area. So you really have to know what you're doing. And again, you use small amounts, but in a deep plane, so it's very effective. But you may have drainage issues, so not everyone is suitable. I'm a classic example of not having tear trough fillers because these bags here, it would be worse because I don't have sufficient drainage.
Well, do you turn patients away when they come in and say, I've read a lot about tear troughs and I really want this procedure?
I caution them and certainly don't treat them if I feel that it's inappropriate. There are other ways of treating the tear trough area. Again, depending on very careful assessment as to see if that's volume loss or it's related to mid-face loss, or whether it's more superficial and you can use other things for that. Certainly these days, like the polynucleotides.
Oh, okay. And are lip fillers permanent?
Excuse me. They shouldn't be. I don't use any permanent products, and one shouldn't really in aesthetic medicine. The reason that sometimes you see fillers lasting a long time is, again, the wrong filler and the wrong depth. So you may well see that in the tear trough area, and you can see it in lip fillers. Unfortunately, this happens, and it's usually done by inexperienced practitioners that don't know what they're doing.
All right, thank you very much, Dr.
Okay.
Sibthorpe.
Well, thanks very much. If you do have more questions, please write in through my website. Thank you.